everyone. I'm Geraldine Pitschke, and welcome to Aging Well in Georgina. Did you know that, according to Stats Canada, people 65 and older are Canada's fastest growing group of cannabis users? Very interesting. But a lot of those people grew up when pot, weed, marijuana, whatever you call it, wasn't even legal. And so that has led to a lot of questions, a lot of misconceptions. And so we thought that having a Cannabis 101 discussion, especially from an older person's perspective, was a great idea. Joining me this morning, I'm so happy to have this guest, is Dr. Stephen James. He is the staff physician at National Cannabinoid Clinics, and he's also the staff physician at Center for Pain Management. And he's going to join us. So let's welcome Dr. James. Good morning, Dr. James, and thank you.
Morning. Thank you for inviting me.
And you're involved in anesthesiology and interventional pain medicine. Can you tell us a little bit about that?
So my main focus right now in my practice is chronic pain management. So people who suffer from chronic degenerative disorders, spine injuries, chronic migraines, etc., come to see us and our staff to help with their medications, and to see if they're eligible for certain types of procedures that may help alleviate their pain. They may not be curative, but does improve their quality of life. And that's our main goal for all of our patients.
That is so interesting. And I know that I said you were the staff physician at the National Cannabinoid, it's a hard word to say, Cannabinoid Clinics. So the other thing is, what kinds of conditions or pain are older adults using medical marijuana for?
So generally speaking, CBD primarily has all the positive health effects of cannabis without the negative long-term side effects. There's virtually no risk of addiction or dependence or tolerance. Basically, just drops under your tongue or capsule once or twice a day. And it has been shown to be very useful for a variety of health conditions. Equally important, people still drive, go to school, go to work, and still be high functioning without being impaired. Now, to answer your question more specifically, 3 broad types, categories may be treated with cannabis. So as you mentioned before, chronic pain patients who suffer from degenerative disorders or chronic injuries, or autoimmune disorders like chronic inflammation, bone pain, spine pain, nerve pain, muscle pain, and the like, may benefit from a trial of CBD. Equally important, those individuals looking to wean off their medication, such as opioids or narcotics, or looking to reduce the release, or may use it in parallel, also be a reasonable treatment goal. Other patients may be suffering from disorders, anxiety, depression, stress. And a lot of studies have shown that CBD in combination with antidepressants or anti-anxiety medication may also benefit them. In fact, even reducing the medication may be reasonable as well. And thirdly, clients suffering from sleep disorders like insomnia may benefit in restoring that aspect of their life, especially if you have trouble falling asleep, staying asleep, or waking up non-refreshed.
There are lots of uses for medical marijuana. And of course, a lot of people would have been on other prescription drugs to deal with some of this pain. And so now when you change over to using medical marijuana, so what is the process? I know you talked about, which is really interesting, you talked about the different types of pain. There's obviously new discoveries in various forms of marijuana as well. Could you just share a little bit around that?
Sure. Cannabis, primarily CBD and or THC, can be consumed or ingested in a variety of forms. The most common are oils, basically just drops under your tongue, capsules or soft gels, vaporizing it, a dry product, or vaporizing oil using vape pens. The traditional way is smoking it. We don't promote that, but it's a personal choice. On the horizon now, we have edibles and topical agents and an oral spray. Now, several differences do exist between ways of using it. Oils and capsules are more common, especially for the general population. The main differences between oils, capsules versus smoking, vaping are how fast it begins to work and how long the effects are seen. So for example, using an oil or capsule, the effect may not be seen for 60 to 90 minutes, but the effects may last up to 8 to 12 hours. Alternatively, smoking or vaping may see a quicker onset than 30 minutes, only last 4 to 6 hours. So depending on your needs or healthcare goals, discuss with your healthcare provider what route may be appropriate for you.
You know, it's really interesting. I would sit in on the hospice coffee and chat in the morning. I did hear a lot of people in their 70s and 80s talk about wanting to know more. You know, they were talking to their doctor about using medical marijuana. And so, you know, what are some of the most common initial questions that people ask regarding marijuana use, especially if they have never used it before?
Right. So first of all, a large number of patients are eligible to be good candidates for cannabis use. So if someone's suffering from spinal stenosis, whiplash injury, degenerative discs, rheumatoid arthritis, osteoarthritis, fibromyalgia, chronic migraines, mood disorders such as anxiety, depression, PTSD, insomnia, cancer, and cancer-related symptoms, all may be very good candidates for trial of CBD. Now, that being said, caution must be exercised in certain individuals, such as those patients with severe heart or lung disease, an untreated substance use disorder, patients less than 25 years old, untreated mental health disorders, or an allergy to cannabis. But some of the more common questions we do see are, what are the long-term and short-term risks? As I mentioned before, with CBD-based products, the risk for addiction to medicine withdrawal is quite minimal. The most common side effects we see are dry mouth, cough, fatigue, drowsiness, headache, blurred vision, and some nausea. Another common question patients may ask, what is the cost to myself? So currently, cannabis is not covered by OHIP, but may be soon. But it's important to remember it is tax deductible as a medical expense. So if you save your invoices or receipts, your accountant can process that and have the money returned through CRA, like any other prescription. Compassion pricing and compassion programs are available through the licensed producers for those patients who have fixed or limited budgets. The common question is, what is the difference between recreational versus medical cannabis and accessing it through either route? The main benefits of accessing cannabis medically is you have a healthcare professional following you and guiding you through the process to ensure the best response possible and without any long-term side effects. As I mentioned before, it's tax deductible, it's compassion pricing, and may be covered by third-party insurance. Those patients who are authorized to have medical cannabis may possess up to 3 times more product than a recreational user. And regarding licensed producers, they have greater access to stock and wider products more readily available. So in times of shortage of supply, medical cannabis is protected. And the most important thing to remember with medical cannabis, the 42 or more companies that are regulated through Health Canada ensure purity of product and very accurate labeling.
You know, there's so much information, isn't there, around medical marijuana? And I'm sure, I know for myself, when I would listen in on conversations from older people, especially at hospice, you know, they're thinking, am I going to get high? They want to know, am I going to get high? Am I going to get addicted? I mean, there's so many misconceptions. There's so many questions. And I'm so happy that you came and joined us this morning to share this information. And I'm sure that that's some of the things that you're hearing. People worried about being addicted. And also, you know, how do they get off of their other medications if medical marijuana turns out to be excellent for them?
Right. So the most important thing is getting the referral to see a healthcare professional, either a nurse practitioner or a physician. Referral can be made through your family physician or a healthcare specialist, or a self-referral can be made. And then once the referral is made, the assessment is made by a physician, medical document is authorized. You are linked to a licensed producer through Health Canada. An educator will teach you how to use the medicine so it's safe and confident. And then the medication is mailed to you by secured courier, 3 to 5 business days, at which point you begin using it, and you follow up with your physician. At that time, we will assess your response to therapy. And once the medication begins to work, we will work with you and your other healthcare providers in weaning you off of the medications you wish to discontinue.
And you are the staff physician at the National Cannabinoid Clinic, and we do have one of those clinics in Keswick, which is really excellent. And so if a person wants to connect, do you have a website? Do you have a Facebook page?
Yes, I encourage anybody who has interest or general curiosities about cannabis, please call our number or log on to our website, nationalcannabinoidclinics.ca. And there's a wealth of information there for patients and healthcare providers, especially for first-time users who are just curious for themselves or their family members.
Yeah, this has been great. I mean, I think I still have so many more questions. I know we have to go to break in a couple of minutes, but so for yourself, how long does it take to get onto medical marijuana? I know there's a process. How long would the process be?
Once a referral is made by your physician or self-referred, generally within 1 to 2 weeks, expect a call, an appointment to be set up for consultation. So it's fairly quick and efficient. The process is very patient-friendly, especially during these times. It's done virtually through Skype or over the phone.
Because I know of a lot of people, if I go to the doctor and I need a prescription for something, I get my prescription, I go to the drugstore, I get it filled out, it's immediate. But it's not like that with medical marijuana yet. I guess not yet.
Not yet, but it only takes a few days to see the physician, have the medical document authorized. The medication comes to you within a week. So it's not completely unreasonable.
No, that's actually very good, really. So I hope that a lot of our viewers, I know I've learned a lot this morning because there is so much information, and I hope that a lot of our viewers will go onto the National Cannabinoid Clinics website and their Facebook page. It's pretty easy to find, and I know that the information will come up on the screen. So thank you, Dr. James. I know you have to leave us, which is maybe you'll come back another time and talk some more. So I really appreciate you joining us this morning, and thank you. We're just going to go to a quick break, and we'll be right back. Welcome back, Georgina. Today we're talking about medical marijuana and the fact that according to Canada's stats, or Stats Canada, people 65 and older are the fastest growing group of people using cannabis. So this is really, really interesting. Joining me now is Philippe Lucas, and Philippe is the VP of Global Patient Research and Access at Tilray. And so welcome. Thank you for joining me this morning, Philippe.
Thank you so much, Geraldine. It's a pleasure to be here.
So tell me a little bit about, you say PhD candidate, and tell me a little bit about this.
Well, Geraldine, I've been involved in medical cannabis in Canada for about 25 years. And over the last 15 years, I've been an active medical cannabis researcher. And within the next few weeks, I'm going to be finishing up my PhD, which is focused on researching patient patterns of use and the impact of that use on quality of life, prescription drug use of medical cannabis patients.
Wow. Well, congratulations on all that work, because PhD, boy, that is a lot of work.
It has been, but it's been a great adventure. And over 20 years of working with patients, it's been a real honor to be part of the healing paths of so many individuals.
And so, in your research, of course, people 65 and older, and so many people 65 and older grew up when marijuana was not even legal. So it does lead to a lot of questions, doesn't it?
It certainly does. And that's what I'm trying to answer with some of my research. Tilray has been sponsoring a study called Medical Cannabis in Older Patients over the last few years. And it's a multi-site trial that includes the NCC, Dr. James's clinic as well, that tracks the impact of medical cannabis on patients over 50 years old over a 6-month period of time to see how it impacts their symptoms, their quality of life, and their prescription drug use. And that's been a really exciting way of trying to learn more about how older patients are using medical cannabis and the impact it's having on their lives.
I know and a lot of people are really, really interested in using medical marijuana. And there are lots and lots of great outcomes as well.
Yeah, it's over the many years that I've been doing this, the biggest number of invitations I get to present information on medical cannabis is actually from retiree groups like Rotary clubs, Provost clubs, newcomer clubs. And I knew that medical cannabis had kind of broken through the surface to some extent when my mother and my in-laws started asking about the use of CBD to treat a number of different conditions.
Just to help the viewers and myself as well, what is the difference between THC and CBC?
It's THC and CBD, I think, is what you were looking for there. The difference is, well, they're the two most common cannabinoids found in the cannabis plant, and THC is what's associated with the psychoactive effects, the high in cannabis, but it also has many therapeutic properties, including being quite a powerful analgesic and useful in the treatment of a number of different conditions. CBD, on the other hand, is non-psychoactive, so it's not associated with getting high. And if you've heard about the use of medical cannabis in the treatment of pediatric epilepsy, what you're really hearing about is the use of CBD. And when it comes to older patients using medical cannabis, it's almost exclusively the use of orally ingested CBD that we're talking about. That's what our research is teaching us right now, that most older patients are really interested in exploring the use of CBD for conditions like chronic pain, arthritis, insomnia, and also benefiting from some of the side benefits and the improvements in mental health, stress, anxiety, and depression.
So those are really some really interesting findings from your research, and that's really excellent. I'm sure a lot of people can really agree with that, especially if they've just started to use it. Are people worried about the cost? I know Dr. James in the first half of the show was worried about the cost, and does insurance cover it?
Yeah, cost is always an obstacle to access. And of course, for older populations that may be on a fixed income, there's no exception there. But there is some good news on that front. We are seeing more and more private payers, private insurers now covering the cost of medical cannabis. And at Tilray, where we work, about 10% of our patients get some kind of cost coverage. So if you're someone interested in using medical cannabis, be sure to contact your insurer, find out if your healthcare savings account can cover the cost of medical cannabis, or your actual prescription drug coverage would cover it. Major insurers like Sun Life, Green Shield, Express Script, they all have medical cannabis coverage packages that may help you reduce the cost of medical cannabis. At Tilray, we've been at the forefront of advocating not just for private payer coverage, but for ultimately public payer coverage through the provinces. And until that time, we also offer discounts for low-income patients as well to make sure that cost is not a barrier to access for patients.
Especially if people are going through cancer and, of course, all the pain that goes with that. And for a lot of people, they have been using a lot of different medications. And there's a lot of side effects of a lot of medications. And so medical marijuana, from your experience and from your research, are there some side effects like?
There can be with some adverse effects associated with the use of THC. I think that Dr. James covered some of those. There can be dizziness and disorientation, dry mouth, red eyes. These are very common effects for people who are using higher THC products. With CBD, we see fewer side effects or concerns. It certainly doesn't lead to impairment, although there can be some somnolence or sleepiness that can be associated with higher doses. But the really nice thing about medical cannabis products in general is that patients research suggests that patients develop a tolerance to some of the side effects, even the psychoactive effects of THC, but don't develop a tolerance over time to the therapeutic effects, which it makes it quite different than, let's say, opioids, where patients who are on long-term opioid use may have to increase the dosage in order to get continued pain relief. We tend to not see increase in dosage of medical cannabis over time. And in fact, our research suggests, particularly with these old populations, that dosages may reduce over time, which is kind of exciting as well.
That's really, really interesting point, Philippe, because, there are a lot of people who get addicted to prescription drugs if they've been using them for a long time. I think that that's probably something that people worry about with marijuana. You're going to have to use more and more. And of course, as you say, probably not.
Yeah, there's there's no dependence potential associated with the use of CBD and a very low potential for dependence when it comes to THC. And in fact, what we find, and some of the research that I've been publishing over the last few years, is that when patients introduce medical cannabis in their course of care, they tend to see a subsequent and rather rapid decline in the use of other prescription medications. And that includes opioid and non-opioid pain medications, blood pressure medications, anti-seizure drugs, diabetes medications, and antidepressants in these older populations. In fact, in the study that we're doing of patients over 50 right now, opioid use at baseline was at 33%, and that went down to 12% of patients at 6 months. That's a 63% decline in the percentage of users using opioids. And just as significant, the average dose of opioids went from 144 milligrams per day at baseline to 38 milligrams per day at 6 months. That's a 74% decline in actual opioid dosages used by those patients as well. Now, when you decline the use of opioids, you decline opioid-related side effects, whether that be constipation or the fear of dependence. And of course, unfortunately, all too often in Canada, the risk of dependency leading to more serious adverse effects, morbidity and mortality.
Wow, so much information. That's really excellent. So before we run out of time, I really want to get to this. I hear a lot of people say, oh, I'm just going to grow in my backyard. Or I'm just going to go down the road. I have a friend who has a friend, and I'm going to get some from there. And so backyard growers, users versus working with a physician, probably at at the National Cannabinoid Clinic. I try to stay away from that cannabinoid word.
Yeah, I'm an active, organic food producer myself. I love gardening, and cannabis certainly is an exciting plant garden. It's very easy to grow, but it's very hard to grow well. And companies like Tilray are there for those individuals who prefer to have a standardized product, who may not be able to grow their own, may choose not to grow their own, and want to get something that's considered to be medical grade cannabis products. So all of Tilray's extract products are manufactured to GMP, which is good manufacturing practices. And that's how all traditional pharmaceuticals are manufactured in Canada and around the world. It guarantees a level of safety, consistency, and quality to products so that when you're using your product, when you get used to the right dose, you know that from one use to the next, it's always going to be the same and the same effect. So predictability is one of the things that particularly older patients want to be able to have when they're using medical cannabis products. And certainly that's one of our goals, producing these highly dependent, high quality products.
There are definitely, your organization, your company, Tilray, and then there's the National Cannabinoid Clinic. And so these have information and educational components to them. So if anybody wants to know more, there is an educational component. And also the contacts. I know Dr. James talked about going on the website for the NCC and also the Facebook. So there are definitely ways to connect. It's really interesting too, Philippe, because my son one summer worked at a marijuana producing for a company, and he just worked there for like 2 or 3 months. And he said that for most of the orders that went out, there was a lot of veterans.
Mm-hmm.
So, I think medical marijuana honestly has so many different applications and can help so many different people.
Yeah, it's quite amazing. Police and military veterans get 100% of the cost of medical cannabis covered by the federal government. So certainly if you qualify for that, make sure that you talk to your doctor about it and that you apply for the Veterans Affairs coverage for medical cannabis. I think that, aging is difficult. Aging is challenging for a lot of people. And if the use of medical cannabis can help with that aging process, help people have a more active life, and increase quality of life. We're happy to be part of that journey at Tilray. And I think we're lucky to work with partners like NCC. They can help patients find a pathway, have access to information by very well-informed physicians like Dr. James in order to consider whether medical cannabis should be one of their treatment options.
Well, I really, really appreciate you coming and joining us today, Philippe, and sharing all of this great information from your research and your own personal experience. And so thank you so much. And hopefully we'll have you on the show again. Honestly, I would love you to come back. You've got so much information.
Thanks, Geraldine. It was a real pleasure. Thanks for the interest in this work and research. I'll look forward to sharing the final findings of our older patient study once they're ready for publication.
Excellent. That would be really great. So thank you for joining us today. For the viewer, all the viewers, thank you for joining us. And hopefully you'll join us again for Aging Well in Georgina. Until we meet you again, bye for now.